All right. It is May. So Dr. Goldberg and I are going to be talking today, as promised, about part two of marketing. This will be specialty marketing. Now, if you're a general practitioner, don't stop this recording. There's going to be some good ideas for you in here as well. But this is specifically for the specialist and how to get more referrals, how to generate more referrals, just more new patients in general, which typically, word of mouth versus non-word of mouth, online, all that. We'll talk about all of it. So, uh, Dr. Goldberg, take it away. Where do you want to start with this?
So maybe I'll start with a story.
All right. Let's
Um,
Fireside chats always have to have a story.
so a lion, you'll see a lion out in the wilds, and they're lazing around.
Hopefully,
They're not
hopefully you're seeing the lion out in the wild. Hopefully you're not seeing them
correct.
in your
But when you
neighborhood.
see them, you see they're sort of lounging around,
Mm.
right?
They look
And,
lazy.
and you'll see little animals passing by all the time. And the little animals aren't concerned, and the lions pay no attention to them.
Mm.
Why? They could easily catch those little things, but lions are smart. They know that if they go after a lot of little meals, they're expending more energy than if they go after one antelope.
Mm.
And that's a marketing philosophy that I think eludes many dental practices. They go after a lot of little things instead of going after big things. So when it comes to specialists, who are the specialists market? Their market really, I mean, you could do two things. You could market as a specialist, you could market to the public. You could market for specific problems. So if you're an oral surgeon, you can market for third molars. If you're a periodontist, you can market for implants if that's what you do, or for gummy smiles. You can market for problems. That's very difficult marketing. It's it's expensive, it's time consuming, and there aren't a lot of companies that do that really, really well. My preferred method of marketing for specialists
Mhm.
is go where the patients are. Who else has your avatar? So if
Mhm.
you want to do third molars, right? Who has patients that need third molar extractions?
Mhm.
Well, pediatricians have those patients. Pediatric dentists have those patients. That avatar is a young person somewhere between the age of, 16 and 21. You know who has those patients? The university's health service.
What does that mean?
So when do people get third molar problems?
Yeah, they're high school, college age. Yeah.
And usually before finals.
Right before finals. Yeah.
Right, because their immune system is low. They're studying. They're not, taking care of themselves. And boom, third molar problems. Do you have a university near you? Do they have a health service? And could you say, hey, listen, you have somebody coming in with a wisdom tooth problem. Hey, send them over. My point is, though, think like the lion. Think about big game rather than little game.
Mm.
Does that make sense?
Totally. I think that analogy works for a lot of things that we do, like arch full mouth dentistry versus single tooth dentistry. It's the same sort of concept. Same thing here. So I want to make sure I understand completely in translation. Let's say I'm an endodontic office, because we mentioned some other ones, but not endo. We put here endo. So I need toothaches. I need where people, would be showing up with a toothache because they didn't take care of it. And that would be where?
Usually in emergency rooms,
Emergency room. Yeah.
it- um, and other dental offices.
Yep.
So, the most dental specialty practices are reliant on other dental offices.
So how would let's say, 'cause I totally get that. I mean, I was thinking emergency room, just glad I was right and use that emergency room. So I'm an endodontist. How do I get my referral pad in the ER room so that they pay attention to me? So they actually refer to me. How does that happen? Is that
So,
impossible? It feels impossible.
so it's not impossible.
Okay.
So first of all, many hospitals have dental departments. So the easiest thing is to get on the faculty of the dental department. Some of the dental departments don't really even do anything. Um, but you have to go to, 2 meetings a year or something like that. Um, so you can get on the hospital faculty. Um, but you're giving them a solution to a problem they have.
Hmm.
So you have to understand their problem.
Yeah.
Their problem is they want to turn over patients as quickly as possible. Same thing with urgent care centers, by the way,
Yeah.
which
Yeah.
have to a certain extent replaced a lot of emergency rooms and primary care doctors. Now
Yeah.
everybody there's an urgent care center on like every corner. Um, they want to turn over the patient really quickly. So they need if you offer them a solution to a problem they have, which is how can I about how can I go about um, finding a solution for my patients quickly.
Yeah.
You have so if I was
Get in front of
going
that.
in, so if I was going in, I would speak to the head nurse and say, "How many toothaches do you get here?"
Hmm.
They get. I mean, I ran a hospital dental program, so I know I they get a lot of toothaches,
Hmm.
right? And they're always at night. So if you say, you know what, I'd like to help you. Any toothache that you get, I'll cover you. I'll be your toothache person.
Hmm.
Now, you may or may not want to do that. If you say that, you have to follow through.
Yeah.
And it means that you might be getting a lot of phone calls at 3 o'clock in the morning.
Well, but they might be getting them out of pain and then referring them to you the next morning within reason. Like that could be your way to offer your services, right?
So, yes, but again, the reality in emergency rooms is that they don't get them out of pain.
Mm-mm.
Um, so, so you could theoretically, if you were an emergency room doc, you could give somebody an injection of lidocaine and make them numb for a couple hours and send them home with a prescription.
Hmm.
Um, Physicians do not give injections in the mouth.
Mm-mm.
They're scared of it. It's a,
Mm.
it's the big black hole, and they don't go in there.
Hmm. Interesting.
So getting them out of pain is usually involves a prescription. And today, nobody's giving out narcotics. So it's usually a nonsteroidal anti-inflammatory and an antibiotic. And they're basically going to suffer for a bit until they can get to see you.
Hmm. I didn't know that. So they're not going to open and drain a tooth for sure. Yeah. I'm hearing all my clients, on the endo world going, I'm not seeing a patient at 3 a.m. I'm too busy as it is, you know.
And
But
that's,
there could be a solution there where at least they have your referral pads and they know where to send them the next day or something.
well, and again, you also have to think demographically.
Mm.
What
What
patients are going
client
to the
is walking
emergency
in the
room?
emergency room? Yeah, exactly.
Are they are
That's the
they
second question. Yeah.
are they on public assistance?
Hmm.
Do
Yeah.
they have, are they insurance dependent? And are
Hmm.
you involved with that?
Yep.
So
Totally get it.
it might not be your demographic.
Yeah. But it is an option. It is an option. Okay.
It's a possibility.
So let's go.
The idea is just to think big.
Yeah.
Where
Bigger fish. Where are those
where
patients?
are many of those patients rather
Yeah.
than go one by one?
And we do the 80/20 principle here, and you grade your referral sources and that whole thing. We all know this. You want top 20 referral sources. That's the relationship you want to nurture. So any specialty marketing hacks when it comes to marketing to GPs that works better than say others. Uh,
So there's one really special one that I love,
mhm,
and that is having the specialist sponsor either a study club
mhm,
or CE events for general dentists.
yeah,
If
yeah.
you're a specialist, don't be paranoid about teaching general dentists how to do some of the things you do.
Mm. So
There's a
you're
way.
talking from a clinical standpoint. Okay. So about 80% of our specialty clients have us do a study club every other month. So, for example, they'll do clinical on odd months, and or our coaches will do non-clinical on even months. And they'll come in and we'll do like stop cancellations and great call process or case acceptance or marketing or insurance freedom, canceling cancellations, all those sorts of things. Is that also okay? Is that also a way?
Absolutely.
Is a
Um,
law of reciprocation or whatever?
so yeah, it's the law of reciprocity.
Reciprocity. Yep.
Right? I'm going to do something nice for you, and it makes the practice stickier. So
Mm,
one of my so I told you Thursday night, speaking at an event that is sponsored by an endodontic group, and that's the process that they're going through. Um, from a specialist perspective, look, the more successful their referring doctors are,
yeah.
the more patients they're going to refer.
And don't you think that study club's a great way to get your foot in the door to the offices that aren't referring to that you're wanting to get in?
So absolutely. So that's one of the reasons that all of the events that we put on, we record,
Mm,
and
yeah.
those recordings are basically lead magnets.
Hmm.
Look what we do.
Yeah.
Now what we for this for this study club that we're
Hmm.
sponsoring. Um, we're also we're telling them what the value is. What
You're marketing the study club.
you're giving them a gift,
Hmm.
right? I'm sponsoring it. Well, what's the value?
Yeah.
I mean, it's thousands of dollars.
Yeah. It's usually $1,000 per person. So, you're sponsoring that. So you got to let them know. Thousand, maybe on your marketing piece to the GP, it's $1,000 with a line through it, paid for by, and then your office. Is that what you're saying?
Exactly.
Hmm.
Exactly. Otherwise, people don't know what the value is.
Yeah.
You're giving them a gift.
Yeah.
And membership is deferred, is paid for you by
Got
such
it.
and such. And when you do it like that, by the way, you can actually join forces with other specialists.
Yes. It's a
So
great idea.
you can have an endodontist, an orthodontist, a periodontist,
Hmm.
an oral surgeon join together
Yeah.
and
So,
promote.
so I have two thoughts, and I'm gonna give them both to you now so I don't forget them. Do you think the local dental society being a part of that is fulfilling that? And or should I be having my own event every year that I pay for, bring a speaker in for a day, whatever it is, and full on the whole thing? Like, where do you fall in line with that? Both?
I
Neither?
so my feeling is that if you don't do it yourself, you're not going to get the benefit.
Hmm.
So, and you can tailor it to the specific types of practices that you want to attract.
Hmm.
So if let's say you're a fee for service office, you don't want to have insurance dependent practices.
That you're trying to network with and trying to get patients because you're going to
Correct.
run into a brick wall where they're not going to refer to you.
E-
Or
Exactly.
they'll say things at the front like, well, you could go there, but they don't take your insurance. They don't know how to verbalize that.
Exactly.
Hmm.
Now, one of the things that I'm doing with this particular group is we're having a study club for the staff,
On insurance freedom or cancellation. Exactly. Yeah, not just the doctor.
not just the doctors.
That's more of a paid for event. Maybe how long would that be? Like, what does that give me the logistics of that? What does that look like? It's Zoom. You're coming via Zoom. How do you do it?
So we're doing monthly Zooms
Hmm.
and we're doing twice a year live events.
And the live event's a day long.
No,
No, how long?
no. Live events are usually a lecture and a dinner.
Oh,
So
okay.
you're talking, 3 hours.
It's a little flavor. It's a little flavor.
Yeah, and I'd like your advice on this. I find that live events, unless they're really, really crafted well, which is really hard, lose energy at lunchtime.
So I do a 2 day event. So I'm speaking for 14 hours. And I think it depends on the content and what you're covering and all of that. And is the content worthy of that? So like our event next week will be Thursday, three different opening breakouts for a day. Then it'll be Friday, Saturday, really is the program, all the different speakers, Friday, Saturday. And then Sunday, there'll be a life mastery by me and my wife. So somebody could end up being there for 4 days going through all of this. We have two of those, two people doing that. They're going leadership, they're doing the Friday, Saturday, and they're doing life mastery. So if your content is good, I'll let you know how they're doing on Sunday. Are they like, wow, but I think the Sunday's light. It's an 8 to 3. It's not
How many of
full
those, how
day.
many of those do you do?
Our event like that, we do one of those a year. Now,
Right.
our mastery events are our 2 day case acceptance training for the whole team. And we'll do we'll do a level one twice and we'll do a level two once a year. And so they're both 2 day programs. But when I've done this for specialists, it's a 1 day event only, compacted version of that. We cut some things out, some fluff out, things that we can get away with. And we're probably, instead of finishing at 5, we're probably finishing more like 4. And you just have to have a dynamic presenter. You have to have somebody who can keep the audience. You got to have them keep them awake. You want to do a shorter lunch, probably. We have a very special client that does this every year in October, and his goal, he wants to get to where there's like 1,000 people in the room every year for an event that he brings the dental community together, and he's of course posting and paying for it. So it's a very, very big, expensive item for him, but it's going to take some years to build it up. So he's going to have his third speaker this October. So I did one. He had a different speaker year two, and now I'll have a third speaker come in, and those are all day events. Now, he could cut it back. He could do a 4 p.m. to 8 p.m. type thing, dinner, and you're eating while you're doing that. For me as a speaker, I don't like competing with food. So if they're eating and they're at rounds, they're not looking at you and they're doing this thing and that, they're just not really getting it. And I think there's not a lot of value there. So if I were to do that, I'd probably try to do it away from food or have the food and then have the meeting or something like that. Yeah.
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 So we're having the meeting and then the food.
Okay, there you go. Yeah, you got to come to the meeting in order to get fed.
Exactly.
Yeah.
Um,
And
yeah,
I
it's
think an important part about the food is if you're the specialist, you're working the room.
exactly
Your team is working the room. They're connecting with the people who make the decisions. You're finding out, you're being interested, not interesting. You're not going to go, hey, do you have my referral pad? You're not doing that. You're learning about their practices. You're staying integrated with them. So, the evening thing kind of reminds me of like dental society type event. Like I did one of these insurance freedom. I was given like, I think a little over an hour. I was on blitz mode, talking fast, but they had dinner and then I got up. They had someone do a little intro and then meet. And I think the other thing that makes it affordable that we got to talk about, and also it's a marketing tool indirectly, is your sponsors. You have to have a great relationship with your sponsors. They want to help you pay for these events. And when you're doing that, they're marketing for you because they're going to GP's office and say, hey, you got to come to this event that Dr. So-and-so specialist is putting on. And now you're marketing indirectly to those offices, whether they come or not.
right. So that's a great point because the sponsors can also help you market.
Mm,
So for instance, the sponsors that I've had for some of the events have been financial planners, insurance agents, accountants, um,
hmm
banks, um, and they may have dentists as clients that are not referring to you now,
hmm
right? So you're getting access. Remember, they don't have the same restrictions that you have. You know,
hmm
your mailing list is,
Limited to something. Yeah.
very limited. They're not. They
Yeah.
don't have they don't have HIPAA. They don't have HIPAA restrictions and stuff like that.
Yeah. We have a great relationship with a CPA that uh, comes to our events and as a sponsor and partner, and they're great to have on site. Really, really great.
So there's all kinds of opportunities, which is how, you can defray the cost
Yeah.
of of these events.
Absolutely. No, it should cover all of your costs if possible, because then it's $0 for you. What about, I
Absolutely.
have in my notes referral lab. What does that mean?
Oh, so there is a program that was started by a periodontist in Michigan, um, called Referral Lab. And it's a program that, I mean, most dental softwares don't track referrals that well. Um, and this program is specifically for gives you the ability to analyze your referral sources.
Hmm.
Referrallab.co, I think it is the website. Newish program. They're they're still very eager to get feedback and monitor.
What? So it's not a dental lab. They're just talking about lab in general hey, we're analyzing referrals. Got it. I
It
gotcha.
basically gives you a
I gotcha.
referral dashboard.
Okay. So that was in our notes from last time. We talked about that.
Huh.
Yes. Got it.
So
Okay. That's a
so I have a
follow-up.
couple of clients using Referral Lab now, and they're really happy.
Okay. All right.
Um,
Good.
prior to this, they were doing it by spreadsheet.
Sure. Yeah. That's how our clients do. We're just tracking it.
Yeah,
So for a specialist, that'd be great because you could put in every single one of your GPs. You could put in wherever they're coming from and see and grade it and do the whole thing.
you can go after the antelopes instead of the field mice.
Yeah. Yeah. I do believe that you want to grade your referral sources. Like you might try the emergency room and find out, wow, we're getting a lot of referrals there, but they're just not the right fit for the patient from us, practice from us, patient to the practice from us. What about ear, nose, and throat? I know you're big on ear, nose, and throat, sleep, TMJ, that whole connection. Talk a bit about our specialists or even our GPs who are doing sleep and marketing that versus like connecting with the ENT and all of that.
So I have a whole program called the physician referral magnet,
Hmm.
because it's that philosophy of going to where your patients already are
Hmm.
and going to where lots of them are. So who has your patients? Well, physicians.
Hmm.
If you're a periodontist, I'd be knocking on every single endocrinologist's door, because they're seeing patients with diabetes. So you want to make that connection. If you're doing TMJ, then yeah, ENTs are a great referral source. 10% of all people, all patients that come in to ENT's office are coming in for ear pain,
Hmm.
and a good portion of those patients don't have ear pain. They have TMJ issues.
Hmm.
So again, it's the strategy of looking who else has your patient
Hmm.
and go to the source. And I think that that's a much better return on your time and investment and money than it is going online.
Okay, so let's talk about time, money, and investing. Most of my specialty clients have some type of marketing director. Some will say, I can't afford that. I don't want that. I'll be that. Where do you fall in the arena of need to have a specialty person for that, or it needs to be you, or you don't need one?
So I think everyone needs one. Oftentimes it's the doctor who becomes that. It is probably not necessary. Again, it depends on your marketing strategy. Um, you want to make your time, you want to leverage your time as best as you can. We all have a limitation
Mhm.
of time. So if I'm going to market to physicians, I'm going to do that personally.
Yeah.
If I'm going to if I'm going to market to um, offices,
Hmm.
well, I may have a marketing director do that.
Hmm.
So it depends on who you want to market to.
Hmm.
Um, I think that there's probably a formula that you can use to figure out whether or not you can afford or it's profitable to have a marketing
That
person.
person. Yeah. What's the return on
Oh,
investment for that?
right. So
Hmm.
you know, what's your new patient value, right? I mean,
Hmm. Hmm.
what's your lifetime value for a new patient,
Hmm.
you know? And what are your current patient acquisition costs? How much are you spending to get that person? You need to understand that dynamic in order to figure out the profitability. You can't afford to throw $100,000 event yourself, no sponsors,
Hmm.
if you're going to get 10
And people in there or
10
whatever. Yeah.
people and the
Yeah.
lifetime value of those 10 people is $10,000.
Doesn't equate.
Just lost
Yeah.
$90,000.
Yeah. Yeah. You need to build up to that for sure. You need year after year after year to create some sort of buzz for people doing it. Have it be a consistent time of year that you know is not going to have a lot of interference, all of that. Bring in really good speakers, pay for the food, of course, and the speaker to come in and the room space. It can be expensive, but you can find ways to do it. There's a lot of ways, and we put on events all the time. We figure out a lot of different ways where you can have these at places where you can keep your costs down. And it has to be geographically located well also. So, all right. So marketing director could make a lot of sense to have one. Need to make sure you get an ROI on it. I have a periodontist whose assistant is also his marketing director. So on days off, she's doing that. And they work Fridays to see patients. So I don't know what day they have off, Wednesday or whatever. That's when she's going around to offices. That works for them. Whereas I have another periodontist, he has a dedicated marketing director. All she's doing is staying connected with them in all sorts of ways and going to see them, of course. And one of the things we work on is reverse social media marketing. So reverse marketing means you're following all of their pages, right? Your team is supporting their team, and you're logged in as your periodontal office, let's say. And as your GP office is posting something, you're always commenting on it. Oh my gosh, love seeing this. Wow, that's so good. Looks like you guys had a blast. I think all everybody thinks I need to put out content. I need to put out content. I think that's okay. I think you still have to do that, of course, but you need someone who's constantly making sure they're messaging, commenting, liking, sharing, promoting other people. That's that reciprocity. When you're promoting others, they're going to always be thinking of you. So it's a selfless act of helping their practice as well. Okay, good. Love it. Anything else on this specialty marketing side that we did not cover today? I'm trying to think of what other questions. Maybe budget. Is there a financial budget to this?
So that's really difficult. I mean, people say that your marketing budget should be somewhere between 1% and 3%.
Mm-hmm. Yeah,
Uh,
3%. I mean, 3% is, gosh, for me, it feels like that's got to be the minimum these days, especially
yeah.
specialty practice. It's got to, I mean, what is on $1 million practice? Was that $30,000 a year?
So the challenge today is that for a specialist, especially, is that a lot of your general practice refers are getting bought up.
Mm, by groups, or they have their own internal specialist or whatever. Mm-hmm.
Um, it's getting more and more difficult, which is why
Mm-hmm.
there are more specialty DSOs now.
Well, as a specialist, buying GP practices to make sure your network is feeding you. Is that what you're saying?
No, there are specialty DSOs. So you have oral surgery,
Oh, yes, like just endodontic groups.
just
Yes. Yeah.
endodontics, just oral surgery, and they
Hmm.
have a very different market. Their marketing plan is we're not marketing to the dentists. We're going to market to people for the
The
problem.
public. Yeah.
And they can afford to do that as a large group.
Hmm.
So, for smaller specialty practices, things are getting a little bit more
Hmm.
challenging because of the change in the demographics of general practice.
Hmm. Yeah. If you're trying to be so let's just do the math for everyone too. If you're trying to be $100,000 a month practice, let's just use round numbers. So about 3%, $3,000 a month in marketing.
Yeah,
Feels like a ceiling to me. Um, Feels like it shouldn't be much more than that. Now I'm not counting the marketing director, in that. So you got to take that into consideration. So, you know, uh, I have other offices though. Spend a lot more than that on their marketing. They spend a lot more on that, especially if you're going to do an event or something like that. Now, if you can get sponsors, you can, go neutral and not have any expense. But
I think
yeah.
the real key is to track your ROI.
Hmm. What's giving you something? Yeah. Our tracker has referral source, has new patients by referral source, of course, you know, but oftentimes it'll say, refer by patient, just everybody in there, Google, just everybody's in there. You can get more descriptive with that and really figure out what's working, not working. So, especially with specialist office, you have to be looking at every single doctor's office. How many did you get and how many did treatment? Just got to look,
Exactly.
you got to grade them. Yeah. The referral lab does that.
Yes. Not it goes and figures out the production per refer.
Nice.
And
Nice.
so, a patient from Dr. X is worth
Hmm.
this much. Maybe very different from a patient
Hmm.
from Dr. Y.
Yeah. Yeah. Totally agree. All right. Well, this is good. I would love for us to get questions about this. In fact, any question, email me, put it on the YouTube channel, and then we'll just talk about it. We'll just take your questions. We'll answer those for you as well. I'm sure there's questions out there that we're not thinking of that people want to know answers to that we can help with. So,
Well,
yeah.
I think probably the biggest thing is how do you teach people how to market?
Yeah.
It's it's a skill. It's a learned skill.
Hmm.
So, with all due respect to the doctor who has his dental assistant doing marketing one day a week, what's her qualification for that, other
Mm.
than being a nice, friendly person? It's one of the reasons that I study Dr. Cialdini. You study John Maxwell. Uh,
Hmm.
we're always learning principles of influence and persuasion.
That's right.
You know, the term marketing is not as um, ugly as the word sell. You know, sales is a dirty word in dentistry. Um, but the fact of the matter is that both are methods of influence and persuasion.
Hmm.
So how do you teach your staff? So, so I just finished my presentation for Thursday, and one of the questions is, you know, I'm going to ask everybody to who's involved in marketing? Raise your hand. Well,
A
so
couple people raise their hand here and there.
what do you think? What do you think? In a room full, there'll be about six
Oh,
people. How
20,
many?
20, yeah, 20% most. Yeah, at the most. Yeah. People are like marketing. I'm assistant. I don't do that.
Right. And now I'm going to ask how many are involved in sales. And I bet
Oh
there'll be
yeah. Oh, fewer. I do that one too. Yeah.
how
No,
many
nobody
involved in
raises
sales.
their hand.
And
Yeah.
and in fact, every single person
Yeah.
in the practice is involved in marketing.
Yeah.
Your appearance is marketing.
Yeah.
You say is marketing.
Why do
Everything
people,
marketing.
yeah. Why do you think people have an avoidance to marketing and sales when they're in healthcare? Why do you think they think those are bad words?
Do we have time? So, you know what? So I think it really stems, and this is getting work from my perspective worse. Um, so is healthcare a right?
Mm, I gotcha. Yeah.
If healthcare is a right, then having to promote it in almost any way is
Yeah. It seems off then.
so
Yeah.
I think and I think that we're as a society, we're coming to believe that healthcare is a right.
Mm,
And in that case, selling it is,
feels off.
yeah, it's distasteful.
I will say this though, and I agree with everything you said. And here's still the factor of it. People will tell me, yeah, patients say they can't afford it all the time. And yet I talk to a pediatric office, the patient has Medicaid, and the parent does, and the parent says, yeah, we're not going to do that. Yeah, it's that baby tooth's not bothering them. We're going to leave it alone. When really there's an abscess underneath there, it's going to destroy the adult tooth. They're not having to pay for it, and yet they still don't do the dentistry that's being recommended. And when you go back to influence and you go back to sales, really, you still have to sell the concept of showing up for the appointment, even if it's free. So there's always going to be sales involved in it, even if it was a right and it was free for everybody. You would, by the way, and you would have twice as many cancellations as you have now if it was free for everybody.
So what I'm going to do, so it's how many of you are involved in marketing? How many of you are involved in sales? How many of you are involved in education? And I guarantee you, you're going to have a lot more people raise their hands for
Mm,
education because that's how we're taught in dental school. And when I was in dental school, I don't know if I ever told you the story.
mm-mm,
So I was on faculty, um, as assistant professor at
mm-hmm,
Columbia.
mm-hmm,
And I started a newsletter in my practice in 1984. I thought I had been studying Dan Kennedy, and he was saying you need to be in contact with your customers. Said, fine, I'm studying a newsletter. So my office was across the street from the medical center, and there were a couple of other faculty dentists who had offices around there. And I get called into the dean's office one day, and there in front of him is my newsletter.
Mm.
And he sort of pushes it in front to me. He says, "What is this?" I said, "That's my newsletter. How'd you get it?" He said, "What's a newsletter?" I said, "What do you mean, what a newsletter?" He says, "Isn't it marketing?" I said, "Well, in your definition of marketing, I think you're thinking that it's going to convince other people to come and see me, when in fact, the newsletter only goes to my patients. So to me, it's a communications tool."
Mm.
I didn't want to burst his bubble and say, well, I knew if I said it was marketing, and the reason it got to the dean's desk is because it was perceived by one of my competitors as being marketing,
Mm.
and we were not allowed to market.
Yeah, yeah. Back in the day.
Back in the day, it was
Mm-hmm.
unprofessional
Mm-hmm.
to market. You're still seeing some of that left over in the profession, that it's unpalatable.
Yeah. Yeah.
It's
Canada is still that
unprofessional,
way. Yeah. Yeah.
right?
Well, I think
But they don't understand what marketing really is.
yeah, you got to
It's
define
it's
that clarity.
education,
Mm-hmm.
it's influence, it's
Influence.
persuasion to
Yeah.
get people to act in their best interest.
Yeah. Yeah. Not a
That's to
selfish
be
thing.
ethical.
Yeah. Not a selfish thing. Yeah. What is an advertisement is I think what they're confusing it with. Yeah, an advertisement. Okay. This has been good. We're going to wrap up here
Yeah.
and we'll be back. Our next topic, I'm going to keep under the wraps, but I like where your head's at. I'll say blue vest is all I'll say to accentuate it. Dentists in blue vests. Would that look good? That's what we'll talk about next time. All right. Awesome. We'll stop the recording here. Good to see everyone. Have a wonderful month.
Yeah.